Hello, this video will cover the screening and evaluation for hepatitis C for week 7 of NU 621 Advanced Pathophysiology. In your practices, you will undoubtedly encounter several, if not more, patients with hepatitis C, and you will be the ones who will be making the initial diagnosis and then sending them on to specialists to treat the hepatitis C. So I've approached this video a little bit differently, give you a little background, and then we're actually going to look at the screening tool that is readily available to you. So it may be something that you want to have on your tablet or smartphone or on your computer in an exam room, so that you can pull it up and access it when you're seeing your hepatitis C patients. These are the references that I am alluding to, and the second one, the hepatitis C screening and evaluation clinical decision support tool, is the one that we'll actually be reviewing in this video. Hepatitis C virus is a spherical enveloped single-stranded RNA virus belonging to the Flaviviridae family and the Flavivirus genus. Its natural targets are hepatocytes, and the thinking is now, the theories are that it also targets B lymphocytes. Transmission is through IV drug use with shared non-sterile needles, cocaine snorted through shared straws, needle stick injuries in healthcare workers, or contaminated equipment during procedures or surgery. And it can be transmitted through tattooing and shared razors. My brother actually got hepatitis B from using a razor that a friend of his had used, and unfortunately his friend had hepatitis B. So it can be transmitted that way also. We used to worry about the transmission of hepatitis C through donated blood, but in 1990 they started screening and testing donated blood for hepatitis C. So this has decreased the risk of transfusion-associated HCV infections to less than 1 case in 103,000 transfused units. This is much, much improved. Just a little epidemiologic information. In the United States, 65% of the patients with hepatitis C fall into the 30 to 49 years old range. It is very uncommon in those less than or equal to 20 years of age, and it is prevalent in persons over the age of 40. It's prevalent in the baby boomers. It was always sex, drugs, and rock and roll. Now, I'm going to open the screening tool, and that will be the rest of the video. Make this a little bit bigger so that we can see it. This tool is, as I said, is open to the public and accessible, so feel free to use it. There are no copyright infringements. So the recommendation is to screen at least once per lifetime in adults born between 1945 and 1965 who have never been evaluated for hepatitis C vaccine. The level of evidence for this recommendation is very strong. Or screen at least once per lifetime in patients with previous high-risk factors, including blood transfusions prior to 1992 or a history of IV drug use. Now, those patients with current injection usage of drugs should be screened annually. And then the nice thing about a decision support tool is you just follow the lines. So you do, on all of these 3 different populations, you conduct hepatitis C antibody testing, which has a strong level of evidence. If it's positive, then you conduct quantitative HCV RNA testing. If it's negative in either of the groups, or all the groups, patients with ongoing high-risk behaviors receive a counseling, retesting, and other testings as appropriate. We continue on the algorithm for testing, vaccinations, and screenings for patients with confirmed HCV virus. There are lab tests. They get a CMP, Comprehensive Metabolic Panel, HCV genotype, INR, you're checking again liver, so you want to get liver enzymes and INR, antibodies, CBC and platelets. And if they have hepatitis A and hepatitis V vaccination, then you, if they haven't had these, then you administer them if there is no documented immunity. And immunity is documented through laboratory testing. You're going to do alcohol screening and counseling. And then once your screenings are done and you have the answers to all these questions, then you come up with your treatment plan. And the decisions regarding the liver disease severity, treatment, and other evaluations will determine whether you refer these patients for care and treatment to specialized centers or physicians or clinics. This goes on also to give you a summary of the recommendations as to why you do the things that are proposed in the screening and evaluation tool. And as you can see, the explanations start with the level of evidence, and each one is discussed separately to help you do the best you can for your patients and for your practice. Again, anytime you can do evidence-based interventions, screenings, evaluations, you'll always have the best, not only the best interests of the patient at the fore, but also the best available screening, evaluation, and treatment that we have to date. Of course, you have to stay up to date with any changes in the recommendations, updates, new research that comes through, and so your work is ahead of you, trying to stay up with all of the evidence-based recommendations and guidelines. There are sites that do this for you, and guidelines.gov is a great one because everything gets loaded up to that one site, and you can access by guideline, by disease, by symptom. So please make use of that. Again, any questions, please call me. Download that screening tool onto your tablet or smartphone and use it. And I hope this has been beneficial for you. Thank you.